In this video, I will attempt to explain the basic biology of lung cancer to help patients and caregivers understand why they are seeing or experiencing the symptoms from a cell biology perspective. Cancer can affect anyone at any age or from any background. Whether it be a struggle that you or a family member is facing, it is important to understand what cancer is. Lung cancer, out of all the various subsets of cancer, is the most prevalent, with around 2 million people being diagnosed every year. That roughly translates to an average of 85 Canadians being diagnosed with lung cancer every single day. Lung cancer does not discriminate and can affect both men and women, healthy or sick. There is no sure way to prevent cancer, but you can reduce the risk by avoiding toxic compounds such as tobacco. Cancer at its core is a disease of uncontrolled growth. The rate at which your cancer cells divide is often under the strict control of multiple checkpoints. These checkpoints ensure that the cell is ready to divide at the appropriate time. Cancer cells, therefore, have to develop multiple mutations to bypass the majority of these checkpoints. This is not an easy task, as usually upon detection of a mutation, the cell will undergo apoptosis, also known as programmed cell death. The specific mutation that a cancerous cell develops is often unique to every person, but proteins that are typically involved in enhancing growth or immune evasion are commonly targeted. Tobacco smoking in particular is composed of around 500 different chemicals that either induce damage to the cell's DNA or prevent cells from healing damaged sections. After developing mutations, cancer cells slowly model the environment around them by creating an island for themselves in which they can proliferate outside of the watchful eye of the immune system. To further expand their growth, cancer cells often alter the behavior of normal cells around them to allow the tumor to expand. This is primarily done through degrading the cellular environment around that connects the cells. Cancer cells may also induce new blood vessels to form to supply the ever-expanding presence. Many of the symptoms that you may experience may be attributed to either the physical growth of the tumor, excess energy consumption by the cancer cells, or may be the result of many side effects caused by the doctor's prescribed treatments. Specific signs and symptoms may include a cough that doesn't go away, coughing up blood, even a small amount. As previously mentioned, the blood that is present in your cough is primarily due to the rupture of the newly formed blood vessels that are induced by cancer. Shortness of breath due to fluid accumulation and inflammation, chest pain, general weight loss due to either cancer drugs or various different biological and physiological effects, or persistent headaches. The prognosis or an outcome of a cancer diagnosis can vary wildly from subtype to subtype and from case to case. Every cancer is as unique as its owner, mutation by mutation, and should be treated as such. Statistically speaking, cancers of the lung are generally fairly treatable as long as they are still located at a singular location. Once cancer cells manage to spread through the blood or lymphatic system, it may be difficult to target without affecting other tissues. Various subsets of lung cancer, such as small cell lung cancer, are particularly effective at spreading and generally have the worst outcomes. Thank you for your time. If you like this short summary, make sure to also watch our dance therapy videos.